the South Carolina Department of Health and Human Services is awarding 13 South Carolina hospitals with $45.5 million.
Wow, that includes a hospital in the upstate. Our Carrie Veal is here in studio to explain what the funding will be used for.
The funding is meant to help build specialized emergency units dedicated to helping those having a behavioral health crisis. The department says approximately 80% of youth who have a major depressive episode don't receive mental health care. And suicide is the second leading cause of death for those aged 10 to 14. Nationally, mental health related ER visits for youth increased by 31% in 2020 compared to 2019.
So it's important to have patients evaluated by specialists in the area of mental health. This can be a psychiatrist, a psychiatric nurse practitioner, a physician assistant, social workers with skills.
Now, Dr. Lummel says the crisis units will be built with special sinks and rooms to make sure patients are safe and can't hurt themselves. The new units will be next to existing emergency rooms, so it's easy to provide both mental and medical services. Some of the hospitals being given grants include Prisma Health Oconee Memorial Hospital, Prisma Health Toomey Hospital, which is outside of Columbia, Anmed Health Medical Center, Lexington Medical Center, and a few MUSC locations. The state hopes to have these new units up and running in the next 1 or 2 years. Justin and Tori.
All right, Carrie, thanks for that info.